If the last month has taught us anything, it's that the Republican leaders down in Washington really don't think things through. And that's what we're facing here again with these proposed Medicaid cuts. When we talk about Medicaid, in the state of Connecticut, nearly 1 million residents receive their health care through our Medicaid program. And so we are talking about pregnant women. We are talking about children. We are talking about our elderly. We're talking about services for those with autism. We're talking about nursing home care. We're talking about services for those with mental health issues, the intellectual and developmental disability community. And so we want to ensure that all of these folks in our state and others continue to have access to care. The other piece is really the workforce piece. And what we've seen coming out of Washington, whether it be the NIH funding, they cut that and then, oh, wow, colleges and universities receive a lot of this funding and they're a huge economic driver in many communities across this country. Or these huge cuts to the federal workforce. Oh, wow, there's a lot of people who work for the federal government and now we're seeing the impacts of that. Well, it's going to be the same thing with Medicaid. Our healthcare workforce is significant. And in many communities in the state of Connecticut, hospitals are the largest employer. And so if we cut Medicaid, we're going to see the ripple effect impacting our communities. So I would echo what the good senator said. What we're also seeing over this last month is when people stand up and speak out, the Republicans down in DC realize what they're doing and make changes. And so I'm glad we're here today speaking out, and I encourage everyone to continue to speak up and share about the importance and the impact that Medicaid has on their lives. Thank you.